Welcome to the office. All right, welcome to the office, Juan.
Thank you.
You coming from where?
From Tustin,
Tustin,
California.
okay, you're
Yeah.
local.
Yeah.
Tustin is local. How can I help you? What brings you to the office?
Yes, I have a pain in my espalda, my
Okay.
back,
Okay,
and sometimes my legs.
okay.
Yeah. And right here, the shoulder.
Rotator cuff?
Yes.
So
rotator cuff.
when you're saying you're having a shoulder issue, there's pain, there's limited mobility,
Pain.
pain. So pain when you do what? When you move
when,
it?
When I do exercise,
Okay.
like weight or through the ball,
Okay.
yeah, I feel.
You feel it.
Yes, I feel it.
Okay. I'm going to test out throwing the ball here today, before and after the adjustment.
Okay.
Let's talk about your back. What happened to your back?
I have when I stand up, I have a pain right here.
And what he's complaining of is the left pelvis, left glute area. Okay?
Yes,
And you've had this for a long time.
yes.
Now, tell me, did you have an injury here?
No,
No injury?
No injury.
You sure?
yes.
Okay, because when I look at this thing, I see you had at least 40 years ago, you had a back injury. You had a back injury.
But I don't remember. Probably I suffered fell down
Yeah.
and
When?
30 years ago.
30 years ago,
Yeah.
yeah, a long time ago. And have you been diagnosed with any other conditions, any other issues?
No, I have been kidney transplant.
Okay, that's what it is. So you've had a
Yeah.
kidney transplant. Left side. Right side, left side.
No, the first one I have two
Okay.
kidney transplant. Yeah.
Okay.
This one was around 20 years, and this one around 10 years ago.
Okay, I need to talk about something very important. And I want to share a story with you before I start, okay?
Okay.
So this is, I was trying to understand what happened to your body because, did you have heart surgery too?
No, just 3 bypass. Yes.
Bypass.
Heart attack, but no heart attack.
Okay, so he's had bypass, he's got staples here, he's had 2 kidney transplants.
Yes.
Okay, and I want to share this because it was in my first year of practice. There was a member of the family friend circle, and I had helped one of them with shingles. You know, familiar with shingles?
Yes. Oh, I had.
You've had it
yeah.
before, I'm sure. So this person had shingles, and I helped one person, and all of a sudden they started telling other people. And they sent this one guy in with shingles. And he had this distribution following T12. Okay?
Wow,
Just
yeah.
follow my story, following T12.
Mm-hmm.
So what happened with him, he had one kidney transplant. He was on the list for the second one. I start working on him, 3-4 visits. All of a sudden, the shingle pain starts to feel good, like it's
yeah.
coming down.
Yeah.
But then about 2 weeks into it, he goes, Rahim, I don't know what's going on. I'm getting this sharp pain on my right side. And it's pulsating, it's pulsing,
Wow.
it's pulsing, it's pulsing. I said, well, what do we got to do? And I learned something new, and I want to share this. This is what he described to me, and then I'm going to explain what happened. He went to his doctor, and he said that something in his kidney was activated.
Yeah.
And what happened was this: when they do a kidney transplant, they don't remove the old kidney.
No.
They keep the same kidney. They cut the plumbing, not the nerves. Follow me process, guys. So they cut the plumbing, meaning what? The artery and the veins, right? And the lymphatics.
Mm-hmm.
The nerves were not touched. I started adjusting his T12 for his shingles, is what showed up. That same nerve went to his kidney. It started to wake up. It got bigger. I had to stop.
Yes.
I had to stop. I said, sir, I can't work anymore because the old kidney is going to start to grow. But there's no plumbing, so it's going to create a problem. I'm mentioning that to you. I'm just saying, if during the course of adjustments you're starting to get these pains here, you need to tell me right away. okay? What do I mean by that? You had 2 kidney transplants. Those 2 old kidneys are still there.
Yes.
I don't know what's going to happen, sir. And people are going to listen to this thing and IA is full of it. Okay, good. I'm full of it. I'm just saying it on day 1. Okay?
Okay.
Fair enough? Okay. All right, so you're here for left hip back pain. It's shooting down your leg, or it stays here?
No.
Down to your calf?
Yeah.
Does it go into your toes?
No, just this part.
The calf?
Yeah, the calf.
Okay. And in terms of the shoulder, it's left shoulder, both shoulders?
No, left shoulder.
Okay, and what movement bothers it the most? Up, down, side?
Sometimes, yeah, right there, or when I move suddenly my arm,
It's like a jolt? It's like electricity?
Yes.
Okay, that electricity comes from the neck.
Oh.
And I will be explaining all that, okay?
Okay.
So we're going to talk about his spine. We're going to talk about his shoulder. I mentioned that thing about the kidney because if during the course of treatment you start to get sharp pains on the side, something else is going on, okay? And we need to evaluate that then.
Okay.
All right, just to let you know. Okay. What we'll do, let's go over your x-rays. Let me explain what I see.
All right.
And then we'll do the exam and figure out where we're going to start today.
Okay.
The shoulder is another unique joint in the body, and I'm going to share a shoulder story. Okay. The shoulder is the only joint in the body under 100% neurological control. What does that mean? Well, everything is under neurological control. They did a study many, many years ago, and they did this in animal studies. And what they did is they severed nerves, the nerves going to all the different joints in the body. And this is what happened. When they sever the nerve to the elbow and the wrist and the knee and the ankle, the joint still stays. But when they severed the nerve going to the shoulder popped out of the socket. We know about rotator cuff. We know about the sits muscles. If anyone remembers what the sits muscles are, leave a comment down below. So we have the sits muscles or the rotator cuff muscles. It is under control by the nerves of the lower cervical spine. So we need to evaluate and see, is there pressure here that's hindering the shoulder? Does that make sense?
Yeah.
Okay. Shall we get started?
Okay.
You ready?
Yes, I'm ready.
Let's do it. So guys, we changed up the x-ray a little bit. I don't have a screen sharing here, so I'm going to be playing it over here. We're going to go over your x-rays. This is your AP, this is your lateral. This is looking at you from behind. This is the right side, this is the left side. This is the heart shadow, which is on the left. This is the gastric air bubble on the left. This is your side profile, okay? And on the side profile, we want to see, do we have 60-degree reciprocating curves? And in your scenario, the spine is a little bit straight, okay? A little bit straight.
Okay.
So what happens is your lower back, your lower body takes most of the weight of your body, of your structure. And we'll go in more detail. But let's get an overall appearance. And what are the things that we see here? The first thing we see is this. We're going to talk about this. We have a small gastric air bubble. We know the digestion is off. He's had the kidney transplant, so he's got 2 functioning kidneys on top of 2 old kidneys, so I'm sure there's a lot of scar tissue in here as well. Then there's this big white mass here, and I don't know what that is right now, so we have to send it out to see, okay?
Okay.
This could just be calcification of the colon. It could be something else. I don't have that answer today, but we will get an answer.
Okay.
Okay. We can also see that the pelvis is dropped. We can see that the right side is shorter than the left side, yes? We can see that the spine is curving. And here's the interesting part. This area here is the area that controls the kidneys. That's the kink, okay? All right, we're going to come back to this. When we go over to the side profile, you can still see the white mass here, okay? And again, we're going to need to send out to see what that is. You can see calcification of the abdominal aorta. And all the work that we do here, one, is based on having a level base and foundation. So you're complaining of this, right?
Yeah.
Complaining of this, and it's shooting into the calf.
Exactly.
What I want you to see, there's 3 things going on in your foundation in your spine. Number 1 is you have a rotated sacrum on the left side. We have a rotated pelvis on the left side. So the left side goes up and the sacrum goes back. And that's the disconnect in this left side of the body.
Mm-hmm.
We have a short leg on the right side. Follow my process. The short leg, the measured difference is 15. This needs to be under 7 millimeters for all these adjustments to hold, including for the shoulder and the neck.
Okay.
Correcting your pelvis will bring it up hopefully 3 millimeters to 12. Okay? Sacrum is off 5 millimeters. That becomes 7. I don't know that I'm going to correct all of it, but we're going to see how much we can.
Okay.
Whatever is residual, we're going to have to put a heel lift on that right side, okay, to bring it up for balance. Otherwise, nothing holds.
Yeah, sometimes I
You walk like this.
yeah, but yes, but I lose the balance.
Correct.
Probably a little bit.
You lose balance, meaning you step with your right and you swing your left like this. That's what we'll see when you walk, okay, because the right leg is shorter.
Yeah.
Does that make sense, Juan?
Yeah.
Okay, so today we got to figure out where we're going to start here on your foundation, okay? The nerves that come out of here are what's powering the leg,
Mm-hmm.
okay? And we will decide later what we're going to do with this after a few adjustments, okay? That's your foundation. Now let's talk about the side and the discs. And what you can see here is his L5 disc is pretty darn thin. It's almost touching in the back. So we have a sacrum pelvis L5 combination issue that we need to figure out today. We'll start on the tailbone. Hopefully that's where we find it. And then we have to deal with this L5. The rest of this I'm okay with for your scenario and your situation. But now we need to talk about your neck. And the neck, those are the nerves that come out that control the shoulder, okay?
Okay.
So let's talk about it. When I'm looking here, these are also 30-year-old injuries, 30, 35 years old in the neck.
Wow.
Mira, número 2,
Yeah.
2, 3, 4, 5, 6, 7. Look at this. It's starting here, number 6. Number 6 is tilting back. This is wearing out. This one is okay. This is wearing out. This one is okay. So we have a potential at number 6 that's causing the shoulder. Okay?
Uh-huh.
Now, let's put it together and see what do we got. So we have tailbone, we have foundation,
Mm-hmm.
we have pelvis, we have L5. We have C6 as a potential. The challenge that I have to figure out with you is, I don't know, can you lay down on your tummy? Can you lie down on your tummy to go down?
Yeah.
So we're going to have to be mindful, okay guys? So this case is very, very unique and special because we have to be mindful. You can't just push on your back, right? Because of what's in the front here.
Uh-huh.
Have you had any chiropractic treatment before?
Yes, I had one 2 years ago.
Okay, for what?
For just adjust.
Regular adjustments?
Regular adjustment.
Okay,
Yeah.
all right. Now, last question.
Okay.
Who referred you here?
You do.
You? Thanks, you two!
I saw in YouTube and check online too.
Okay.
Yeah.
All right, sounds good. All right. You understand what I went over, sir?
Yes.
You ready to get started?
Exactly.
Let's do it. Let's see the walk. Stand up for me, please. And you can see him on the bottom right leg. He swings the left leg. All right, sir. Come over here. Have a seat. All right. Let's run the meter on the back and let's see what we find. Well, starting at the base of the neck. So I'm getting 10 points up top, C1. I'm getting, it's lower, C7, nope, not yet. You okay, dude? 10 points. T3, T4. The question is, do we want to do T3, T4 in the chair, or do we want to do it face down? That's the question. Oh, brother. T12, L1. All right. And Juan, you understand everything I went over, sir?
Yes, sir.
Okay. And at any point you have questions, you please ask, okay?
Okay.
If you're uncomfortable with anything I'm doing, sir, please tell me to stop.
Okay.
Cool. There it is. S3, S4, T12, T3, T4, C1. Didn't expect that one. Static palpation, running our fingers down the spine. One, two, three. Okay.
Yeah.
Really?
Pain.
More at the bottom?
Yes.
More at the top?
Top, more top.
That one.
Yeah.
1, 2, 3. 7, 8, 9, 10, 11. Really?
No.
Okay. Let's go into extension. Come back towards me, please. Really?
No.
Okay. This whole area has kind of calcified or okay. Feet together, open and close your knees, feet touching, feet together, open the knees, close the knees, open and close. Right side only, please. When he does the right, the whole left is shifting. Left side only, please. When he does the left, the right side is fine. Good. Now, let's check here, numero 5, number 5. Pain?
A little bit, yeah.
Little bit. S1.
Oh, yeah.
S2. S3, aquí.
Yeah.
That's the one. Let's go one more. S4, not as bad. Starts there. Yes?
Yeah.
S3. S3, T3. Sit back for me, please. And let's check the neck. Let me do the work, please. So we're doing motion palpation, starting at 7, taking the head back into extension. 6. Duele?
A little bit.
Poco.
Yeah.
Right there. Aquí. That's 6, dude.
Right there. Whoa.
Number 1?
Yeah.
See. Okay, let's turn to the left. Let's turn to the right. Look straight, look up and left. This is the lower cervical spine, up and to the right. Down to the floor, this is the upper cervical. That's actually not bad. So, when I do this, more duele?
Yeah.
Or when I do this? No,
No.
top one, C1. Let me check the movement of your shoulder, right side first. This is your good side, right?
Yeah.
Okay. Nice. Left side. Let me do it, don't help. Now, if I put my finger here on the left, go ahead and move your shoulder. Does it feel better when I hold it?
Uh-oh.
Keep going.
Pain.
Keep going. Keep going. Okay, but watch, when I hold,
Oh, I can't. Difficult.
so when I hold here, is it easier to move?
Yeah.
It's a little bit easier, okay? We're gonna start on your sacrum and your C1 today.
Okay.
Then I'm gonna have you walk, then I wanna recheck.
Okay.
Okay?
Perfect.
You ready?
Yes.
Let's start. Let's start C1 here. Sit back for me, please. Let me get a listing of C1. Oh, we're gonna have some fun today, brother. And of course, it's gonna be C2 on the left, C1 on the right. Check it out. So if you look here or there, C2 is actually wedged on the left here. We're gonna set C2 as a PLS, and then we're gonna set the Atlas as an ASR. Okay. Let's raise your right hand, please, up. There you go. I'm putting the seatbelt now. Okay, sir?
Okay.
So, let's do C2 first on the left side. Nice, light, and quick. Relax the head down on the left. Down.
Oh. Hmm.
You okay?
Yes.
Now I need to do C1 on the right. C1 we're going to set it as an AS. Actually as an ASR. ASR, slight P. So we're on the right side here. Stabilized, nice and easy. My elbow needs to be slightly anterior to the patient because it's AS. We want to close the AS. And we want to come in light.
Oh.
Just like that.
Right.
Home run. Perfecto. Raise your left hand. Tell me what's different.
A little bit pain right here.
Is it different?
Yes. Different.
A little bit easier?
Yes.
A little bit. Okay. Can I get a tiny bit more of your Atlas? Poquito más?
Okay.
Bueno? Down.
Oh.
That's it. Okay. Raise it up. We'll get to that part. Come on over here. Actually, no, you know what? Let's do the sacrum on the side. All right, so we're going to set his sacrum S3. We're going to be doing it involved side down because you can see the curvature of the spine. The convexity is on the right side here. So that has to be up. We're setting S3 involved side down. At any point there's discomfort here, you let me know.
Okay.
Okay? Bueno. Número 3. S3 slightly on the left side. Relax the bottom leg. I promise I won't drop you. I send you to Hawaii, all expense paid, 5-star hotel on me, okay? I'm not gonna drop you. There. Now, the key here is we're not trying to twist it. We gotta push. This is a finger push. I'm pushing the bottom sacrum in. He's tight.
Yeah.
You're tight, brother. Relax the bottom leg. No, relax. That's a little baby one. He's gonna make me work. Come on up, sir. Let's go over here onto the table here. You okay?
Yes, I'm okay.
Good?
No. Come. I feel right here.
Tell me.
In my
Your chest?
chest, yeah, and for the
What if I do this?
Okay, better.
Now, I'm not thrusting yet. I'm going to show you what I'm doing here. It's okay up top?
Yes.
Sure?
Oh. Okay.
Gotcha. Home run. Perfecto. Okay. Take your time. Give me your hand.
Okay.
Both hands. March in place first. Knees up high.
Like that?
Okay. Let's walk again, please. This is after sacrum and upper. Qué diferente.
I feel something in this leg.
Go ahead and walk. It's getting a little more movement in his hip. Keep walking. One. Back over here, have a seat. Let's rescope you. Raise your shoulder, left hand up and down. Okay. Let's check now and see if T3 is still there. Neck is clear. T3 is still there. And you saw when I put him face down, he can't take it over there, so we're going to have to do it in the chair. Sacrum is clear, upper cervical is clear. T3 is still there. We're going to set T3 probably as a PLS. Let's just check his hip first. Feet together, open and close your knees, feet touching, slide forward a little bit, sir. Open and close, open and close. Right side only. Left side only. Left side. It's different.
Yeah.
It's moving more now.
Mm-hmm.
Good. Okay, I got one more here to do for today, okay?
Okay.
Sit back for me, please, all the way. We're going to set T3. T1, 2, 3. We're going to set it as a PLS. And you got to come down on it. Look, I want to show you where I'm at. I'm down here. So we're coming down into the joint there. Relax there for me. Is that okay there for you, boss?
No.
Is that okay?
Yes.
Okay. So we want to stabilize, be mindful. You got to make sure that hand is light so you can come through.
Oh.
There you go. That moved, dude. Turn left, look to the left, look to the right. Look to the left, look straight. Let's see if that cleared. Sit up straight. It's a weird feel, but it's set. Mira. T3 is clear. All clear there. Now we're going to get some heat. All right. You remember what S3 felt like, sir? Down in the sacrum? Mira. Come back slowly. All the way back. Número 5.
Yeah.
Número 1. Número 2. Número 3. This is the one we adjusted. Different?
Mm-hmm.
Bueno. Okay, shoulder time.
Okay.
Raise your left hand up again and down. After I did this one, is that different?
Yeah.
Yeah. Cool. Now, light set, light, slowly, slowly. Relax it down. That's it.
Oh.
That's it, boss. Walk it off, please. Ah, nice. And as you're walking, tell me everything or anything that's different.
Yeah. Okay.
Go ahead, one more time. Excellent. Have a seat, please. Raise your hand up and down. Up and down. And do you have any questions for me?
What kind of exercise can I do?
Right now, nothing. Just walking, hiking, swimming. If you want to do anything at the gym, you do elliptical with handles. That's it.
Right here?
Yes, you can do this. Do what's called a 2-to-1 ratio. For every 10 minutes forward, 5 minutes reverse.
Okay.
For the next 2 weeks, there's no workouts. Just lots and 10,000 steps a day or more if you'd like.
Okay.
Okay, I do have a video called Flossing for Your Shoulders. that requires a yoga ball, okay?
Okay.
You have a yoga ball at home?
No.
Okay, maybe you can get a green one like this. All right, can you lay down on the floor please for me here? Lay down on the floor. On your back. See? Bend your knees. Feet on the floor. Bend your knees, feet on the floor. Catch the ball. Throw it up in the air and catch it. Throw it up. Does that hurt your shoulder when you do that?
No, I don't have a pain.
Good. Okay. You don't have pain doing this, right?
No, no
Okay,
pain.
perfect. So he can also do flossing for the shoulders. I have a video on YouTube. Okay, it's called Flossing for Your Shoulder. Come on up. And it's 4 exercises that uses a gym ball. You get a yoga ball, flossing for your shoulder,
Okay.
and so you're going to do your walking 10 to 15,000 steps a day. You're going to do your icing, ice the areas if there's any swelling or inflammation or any pain. Welcome
Yes,
to the office.
Okay. Thank you, Doctor.
Pleasure to meet you.
Okay, nice to meet you too.